Today we're looking at a great article also treating cervicogenic headaches, and it was a multi-center randomized controlled trial where they're comparing upper cervical and upper thoracic manipulation, or thrust manipulation versus a non-thrust manipulation, or sometimes called mobilization. This is in Biomedical Central Journal back in 2016. So first we'll look at participants. They were cervicogenic headache patients. We have the details there, but they had to have subjective and objective requirements for that, at least one per week for 3 months. They had to be somebody who's basically complaining about enough to come in, right? And then excluded with any red flags or blood pressure issues. Outcome measure, the primary one was pain intensity. So anytime you're looking at what a research study, you want to know what's the primary outcome that they're looking at. This one is intensity. The secondary one is disability and global rating of change, headache frequency, headache duration, medication intake. But the primary one they're looking at is pain intensity. So they're randomized into either a manipulation only group, so thrust manipulation, or mobilization group. So the details of thrust manipulation here is they did right and left C1, C2 articulation, because that's primarily what's implicated in cervicogenic headaches. And then they also did a T1 to T2 thrust, which is a center one. So they did 3 techniques there. And then on subsequent sessions, they could do those again, or they could do other areas of the neck or thoracic spine, all the way, and even including ribs, down to T9. Mobilization group was a mobilization and exercise group. So here they did PAs at the right and left C1, C2, and then at T1 to T2. And so they did, I believe it was 3, so it was 30-second bouts at each of those. And that was at least one session. They could either repeat those on the future sessions, or they could, just like the manipulation group, they could target another segment. But notice that they only did one set of 30 seconds at each level. But they all, at one set, right and left of the upper cervical spine, and then down in the thoracic spine. So it's 3 total sets. So one set at each segment they chose, and they were supposed to do at least one cervical or one thoracic each time, and the rib could be thoracic as well. And then they did exercises. These exercises are along the lines of like the Gwen Jewell ones from 2002, her study there in Spine Journal. And we're using blood pressure cuff. We're looking at the upper cervical deep neck flexor control and endurance there. And then they also added 10 minutes of progressive resistance exercises using bands and weights, and particularly focused on the lower trap and serratus anterior, like a lot of us would with a headache, with a patient with headaches. Let's look at what happened. So there's 58 people in the manipulation group, 52 in the mobilization and exercise group. What ended up in each of them. Look at the outcomes. So this went out to 3 months. And at 3 months, the manipulation group had statistically significant better results in intensity. Remember, that's the primary outcome compared to the mobilization and exercise group. And even in the confidence interval, 95% confidence interval, they don't cross there either. So very strong results there. And then we also go to our neck disability index, same thing, and this was a secondary one. It looked at same things, that they don't cross there either. So then one of the strengths they pointed out, and I agree, is that there were multiple physical therapists from 8 private clinics in 6 different states there that were performing this. So it wasn't just one therapist. However, when we're comparing this to other ones, these were all high quality therapists who performed thrust manipulations primarily.
And that is one of the critiques of this paper from others, is that these people, their bias generally was for thrust manipulation over non-thrust manipulation or mobilization. The other bias is that typically people, and one of the other critiques is that typically people will spend longer than one set at a segment they feel that really needs manual therapy at that segment. And their contention here is there's no evidence to support longer use of it there, and that's an accurate statement as well. But if we're comparing it to standard of practice, it wasn't quite comparing to standard of practice of people who use non-thrust manipulation. However, exercise has been shown to be quite helpful in these patients. They showed that manipulation was more helpful, which is different than this one showed manipulation over the mobilization and exercise, which is a little bit different than any other of the other studies that have been done. But if we look back at the outcomes here, the mobilization exercise group did improve as well. And what we don't know is what would they have been like 12 months out. And so that's an interesting thing, you know, so there's really no reason why not to do both of these, in my opinion. And so that way we can get, you know, what if we'd have combined and we'd have gotten any more? And maybe not at 3 months, maybe we would have, maybe at 12 months. Maybe it does make them more resilient to not have a recurrence of headaches. We just don't know. But this is a very well done study that compares two things that a lot of therapists do for the cervicogenic headaches.